Recall our discussion of moral hazard, where the behavior of individuals change with the presence of insurance. The problem of moral hazard is sometimes referred to as a hidden action problem, as the action of how much insurance a person uses is hidden from the insurer. This is an example of asymmetric information. Another important dimension of asymmetric information is hidden information, where individuals differ in fundamental ways that are not observable to the insurer, like their lifestyle choices. In this segment, we are going to discuss hidden information, or as it is more commonly referred to as adverse selection. Adverse selection refers to a situation in which the insurance company lacks important information about policyholders, leading individuals who are more likely to use the insurance to adversely select to enroll in the plan. For an insurance company to properly spread risk, it needs to know how likely an individual is to have high medical expenses. To understand how this works, let's look at this group of individuals, which come in a range of health states. We rank them from healthiest to sickest. We call the healthy people who are unlikely to use many medical services low-risk individuals, as they do not pose much risk to the insurer. On the other extreme, high-risk individuals will be unhealthy people with a high propensity to use medical services. These individuals will spend different amounts of money on medical services. Low-risk individuals will spend very little, and high-risk individuals will spend a lot. In the US, the top 5% of healthcare spenders account for almost half the spending in the country. Now, consumers know this information, but by assumption, insurers don't. From the insurer's point of view, everyone is of the same average health. This is the nature of asymmetric information. Consumers of healthcare have more information about their health status than insurers do. In this scenario, insurers have to charge the same premium from all members, and therefore, the premium will reflect the average expected spending. But when that's what insurance costs, some people, those that are most healthy, will choose not to buy insurance in the first place. This is true even if these individuals are risk-averse. They are simply better off taking a relatively small risk than paying so much to insure against it. If they leave the market for insurance, individuals left in the pool will have higher average expected spending, and the insurer will have to raise the premium. The increase in premium may now lead the lowest risk individuals left in the pool to exit the insurance market. This dynamics of exit leading to higher premium, which leads to more exit, which leads to even higher premiums, is a snowball effect known as the death spiral, which refers to a condition of the insurance markets where premiums are rapidly increasing because low-risk individuals are continuously priced out of the market. So adverse selection may lead the insurance market to fail. It's a serious problem. Recall the notion of risk aversion. The more risk-averse we are, the greater our demand is for insurance. We dislike risk so much, we are willing to pay money to avoid it. But who is more risk-averse? High-risk people or low-risk people? Our discussion is fairly agnostic to this question, and most adverse selection models assume that while people differ in their health status, they are similar in their level of risk aversion. But if low-risk individuals, those that exercise and eat healthy and avoid risky behaviors, are also more risk-averse, we would be in a world where the healthy are more likely to buy health insurance, which would help keep premiums low and prevent the death spiral. So adverse selection exists because the insurance company lacks the information required to tell high and low risk individuals apart. So what are the ways to deal with adverse selection in practice? There are 4 main solutions. Make the information more symmetric, sell insurance to groups and not to individuals, mandate insurance, or offer multiple insurance contracts to separate high and low risk individuals. The first approach would be to make the information more symmetric. This solution suggests that insurers be allowed to collect health information and use that for pricing decisions. This would result in sicker people paying higher premiums and healthy people paying lower premiums. People with pre-existing conditions will face very high premiums or may be denied coverage altogether. While this solution may solve the adverse selection problem, it may defeat the purpose of insurance. Let's imagine that a diagnostic technology can perfectly predict health spending for the next 12 months. Now, if the insurance company knows that I will spend $500 in the coming year, it will charge me $500. And if they discover that I will be spending $500,000, well, that is what they will charge me. So a plan like that does not provide insurance. It simply presents the member with a bill. The purpose of insurance is to spread the risk. The second solution is to offer group insurance, mainly through employers. Instead of having people purchase insurance directly, their employers purchase it on their behalf as a part of a group plan. In this case, the insurance company is selling insurance to a large pool of employees, which represents a spectrum of health conditions. Since properly spreading risks requires such spectrum of health conditions, the insurer has little to worry about adverse selection. But group health insurance does create problems, as it ties labor participation and job mobility to higher coverage. The third solution was proposed under the Affordable Care Act. The idea here was to mandate the purchase of health insurance so low-risk individuals stay in the pool and help maintain affordable premiums. While forcing people to buy insurance against their will may sound harsh, it alleviates the need to use the first approach to mitigating adverse selection. In other words, by mandating insurance, the government can ensure coverage for people with pre-existing conditions. The fourth solution involves offering multiple insurance plans, some that cater to low-risk individuals and some that cater to high-risk individuals. Since the insurance company cannot tell high and low-risk individuals apart, it has to cleverly set these contracts up, balancing 2 key elements of the plan: premiums and coverage.